Hello, my name's Steve. I'm here at Back in Motion, and I'm a licensed massage therapist and PTA. And today we have
Becca. Hello.
And we're going to be discussing a little bit about some relief for carpal tunnel syndrome. Essentially, a lot of the symptoms comes from tightened wrist, fingers, flexors, extensors, and which decreases circulation and causes some nerve entrapment. So to demonstrate some of the couple little techniques to resolve some of these symptoms, we're going to be working on the palmar fascia. We're going to be working on finger flexor, extensor lengthening, and also wrist extensor and flexor lengthening as well. So we're going to basically take each individual finger to start off with. We're going to fold it under. We're going to support at the base of the first joint here, the finger, and we are going to pull back, support, and work on the tendon that leads to that finger to give it some length, and we're also lengthening the palmar fascia. We're going to take each one individually, fold it under, support it, bend it back slightly, and glide up that tendon. Again, this is going to give a little bit of length to each individual finger and create also better circulation and supply. Often carpal tunnel, people experience numbness, tingling in the fingers, loss of grip strength, and a lot of that comes to decreased circulation and numbness as well. So I'm going to extend it up, each one again, up the palm. And then we're going to open up the palmar area. That'll take care of the fingers. Can also lengthen both sides of the finger, the fascia on the finger, increase in circulation again all the way down to the tips of the fingers. As you can see, her fingers start turning red where they were actually white to start off with. So she had decreased circulation down in her fingers originally to start with, and now we're just increasing that circulation to the fingers, and her fingers actually, you can feel that they're a little bit warmer than they were to start with. You can see by the reddening, the blanching. Alright, that takes care of the fingers. Now we're going to fold the wrist downward, fold the fingers under, and we're going to work on all of the wrist extensor muscles. And it's better if I have lotion, so you get a little bit better glide. But basically I'm just working from the wrist all the way down, or up to the elbow, should I say. Lengthening the muscle, again, also increasing circulation. And reducing entrapment, nerve entrapment, circulatory restriction. Then what I'll do is go in the opposite direction, or I will fold the wrist downward again, keeping the fingers straight this time. This allows things to lengthen or get the greatest length out of these tendons and muscles. And just going to start medially, work in up to the elbow. It's a good technique too also for tennis elbow or golfer's elbow. Similar technique because often a lot of restriction occurs in the fingers and in the forearms as well, which leads to a lot of this irritation and pain. But that's essentially it. She should have better mobility, increased circulation all through the forearm, down into the fingertips, into the hands, which should ultimately lead to a better grip strength and less numbness and tingling.
Thanks.
All right? There you have it.